Now we're going to talk about the shoulder and the upper back. So the shoulder is a really impressive joint. So it really has a lot of mobility, and to have this much mobility, it has to sacrifice a bit. So it's a bit more unstable. So to make it stable, you have four muscles that really hold it into place, while your bigger muscles move it around. So you have two in the back here that stabilize it, and these are very important. We need to reinforce them a lot. And you have one on top that goes underneath the acromion here and stabilizes it. So it's very important that that muscle is strong in endurance so that it contracts well, because when it contracts well, the shoulder pivots on itself, and it's fine. And these muscles need to contract also to keep it staying in the right position. If they don't contract, or if they give way while you're throwing or hitting or something, it's going to come up and pinch itself. So if it's the weaker it is, the more it injures itself. So it needs to be strong and enduring. Now, don't forget, the humerus only has 2/3 of the motion. 1/3 of the motion of the shoulder, so 60 degrees of that mobility, comes from the shoulder blade. So this region needs to be really stabilized. So it needs to contract well, but it also needs to be able to stretch properly. That's why it's so important that you massage with the ball here, yes, behind the shoulder, that's very important, but also between the shoulder blades, releasing these tensions here so that the shoulder blade really moves in the proper direction. So we'll talk about how to reinforce those muscles also, and especially on how to make sure that your shoulder joint really is strong enough and more enduring enough so that you can really use it without injuring it. So first up, external rotation of the shoulder. Very important. Basically, you want to go from this position here where you're holding your elbow towards the body. You don't want to let it out. You keep it stable, and you're going to go to 90 degrees, maybe a bit further. So the mistake most people make, and it's a big mistake, is that they're facing the elastic. If they're facing it, well then the problem is they're going to start at 90 and they're going to want to go far. If they do that, chances are they're going to injure their shoulder. So you want to be really sideways to your elastic here. So, and in most of the studies, it's really quite clear that the eccentric part of the exercise, so this part where you're coming back, or the negative part, however you want to call it, is really crucial in the rehab of the tendons. So I suggest that you take away part of the contraction by helping yourself with the other hand to get to 90, maybe 100 degrees, as long as it doesn't pinch, and then slowly come back in 4 to 5 seconds. So in all the exercises, you should take 4 to 5 seconds to come back. So the point is to do it 10 to 15 times, doing maybe 2 to 3 series of 10 to 15. If you get to 15 quite easily, it means you can go a bit further, or you can make it a bit tighter, or you can change the elastic that has more resistance. So you want to work on that and come back slowly. So you're purely working on rotation in this way. So you don't want pain. If it starts to burn a bit, that's fine. As long as you don't have a particular pain, it's not starting to be too precise. Now that was external rotation. It's good to combine it with flexion also. When you combine it with flexion, you can use a free weight, you can use an elastic, you just put it on the floor, and you're working more with the supraspinatus muscle, and you're helping yourself going up the same way, 90 to 100 degrees, you're letting go, and you're coming back slowly. Once again, you don't want to completely let go at the end. You want to keep a contraction, and then help yourself a bit to come back up, and then concentrate on the negative phase or the eccentric phase. So that's quite simple. You can change the angle. You can go more towards the front, more towards the outside. But between 30 and 40 degrees, 30 to 45 degrees is a quite good angle to work on that muscle. The grip is more or less important. You can do it upside down. You can do it side, like neutral here, like neutral like that, or a bit in pronation like that too. Making sure that it is a comfortable position for your shoulder. The important thing is you're contracting and not hurting. Okay, so that's reflection. You can also do it with free weights, and you can do both arms at a time. If you do both arms at a time, instead of helping yourself with the other arm, but to help yourself, you just bend your elbow. So you do kind of press to go up. You stop at 90 or 100 degrees with the shoulder. Forget about the forearm. It's the shoulder that's important. And you get to there, and you kind of extend your arms. So both at the same time you extend, and then you come back lower here. And when you bend your elbow, don't forget not to bring it in. You want to keep it a bit out so that your shoulder is still contracting. And you go back up, like that. And we'll do it a bit faster, you just come down, that's a bit fast. You bend, make sure you don't go back, and then you come back up. Okay? So you can do both at the same time with a free weight. If you're doing external rotation with the free weight, you kind of have to do it on the side, because if you're doing it like that, the weight is pushing down, so you're just forcing with your bicep. You're not forcing externally, so you kind of have to lie down on your side to do it. So that's a lot of effort. It's a lot easier to do with elastic, and you can change the angles with the elastic or the pulley. The pulley is also a good idea. Just make sure that you're careful and it's not too much weight. Next step, when it's easy to do that one, it's very important to go towards your final goal, where you're contracting towards upwards, so your shoulder is forcing up and it's forcing in rotation. So you're basically doing this, you're bringing it outwards like that, and then coming really slowly here. Now, with the elastic, it's great because you can change the angle. Because if you put it higher, the higher you put it, the easier it is for the shoulder, because it's just easy to pull back. That for most people, that's not a problem. It's the actual rotation. But if you're too close here and the elastic's too low, well then when you come to here, it's a lot harder on your shoulder. So if you take a free weight, when you're taking that free weight, when you're here, it's easy. And when you get here, that's where it's heavier, but that's where the joint is the most vulnerable. So you want to be careful there. So what I do when I get here usually is I'm careful, and sometimes I'll actually take a bit of the weight down, or I'll stop before it gets to a painful region. But it's also important to work on that too. But with the elastic, you can vary that angle and make it more or less difficult. And here, with the free weight, you're not forcing because it's going down. You're just forcing up. You're not forcing a rotation. But with the elastic, you are forcing a rotation because you're keeping it there, or else the elastic wants to pull you forward, not down. To make this transition easier, you can start lower and slowly go up and slowly open more. And to make it even easier, you can lean on the wall. To start, you're taking away that component where you're contracting upwards. You're just contracting in pure rotation. And slowly you're going higher and higher till you're comfortable like that. And then you do it without the wall, and then slowly you get comfortable doing it without the wall. Make sure that when you're doing it lower in positions where it's not clear cut, that you're not going too far, because this is far enough. Some people tend to overdo it, and that will pinch your shoulder. So you have to be careful at that. Now, between the shoulder blades, it's kind of a quite simple exercise to do. You basically just want to pull back. So you can do it with a wide grip, as long as you're not doing that. You just have to stay stable, it's always stuck in your stomach, and you're contracting outwards. So you're just pulling both shoulders out like that. And you can do it with a narrow grip like that also. You can also use free weights, and you bend forward, making sure that your back is flat, contracting, very important. And if you have to contract your abdominals too, you have to spring in your stomach. If you're not, well then, because if I let go, it seems like I'm contracting, but I'm only contracting my back, I'm not stabilizing enough, so you need to bring it in. And you can either do it with a wide grip, so wide, or a narrow grip like that. So you're always stopping before you're completely letting go. You have to keep contracting. You want that to always stay stable. You're going back, coming in, you're not letting it go too far, you're just contracting all the time. So basically that's the rehab for the shoulders and the upper back. That rehab will help your neck, it will help your shoulder blades, it will help your lower back, it will help your posture, just making sure that you're not rolling out always like that. So there you go.